Let's go live to Victorian Premier now, 55 new cases there.
New locally acquired cases. 49 are linked to known outbreaks. 6 of those are currently mystery cases and are being investigated by our public health team. Just 25 of those were in isolation for the entirety of their infectious period. So that is a very significant challenge. That makes today a bad day. Now, I have no restriction announcements to make, no rule changes to make today, but I can't rule that out. Ministers and public health officials will be sitting down this afternoon, this evening and into tomorrow, determining whether there's any more that we can do in terms of rules and settings to try and pull this up. Earlier in the week we talked about being at a tipping point. This is very, very serious indeed. Now, I want to just map out for people what's involved if this gets away from us. Hundreds and hundreds of cases every day, and hundreds, indeed, potentially thousands of people in hospital. And anyone who cares to go and interview a nurse in Sydney working in a COVID ward will be told stories that they will never forget. If you can't find one of them, I'll find you a nurse from a COVID ward from Melbourne last year, and they will tell you stories that you will never, ever forget. We cannot allow this to get away from us. We all have to work as hard as we can. Now, the government is playing its part. We locked down early. Couldn't have gone any earlier. We've locked down hard and we've been criticised for that by some, but we are following the advice. But rules are only as good as the behaviour and the choices that each of us make. I can't be any clearer with the people of Melbourne and more broadly, the people of Victoria. If we have a weekend this weekend like last weekend, well then next week it will be like Sydney. Simple as that. This will get away from us. We've got too many mystery cases out there. We need people to come forward and get tested when they have symptoms. Not a day later, not 3 days later, but when you register those symptoms. We need people to follow the rules. And genuinely, stay at home means stay at home. It's not about looking for every loophole, every exemption, every sort of blind corner where people can't see you to do the wrong thing. I get sent lots of stories from lots of different people. You know, there's a whole bunch of people down the Ryback Beach last night who thought the best thing to do was to go and watch the sunset. I'm sure it was a beautiful sunset. But that's not in the spirit or in the letter of these rules. I was out for a walk with Kath last night. Within the curfew, within the 5Ks, wearing a mask. A lot of people out weren't wearing a mask. We all have to make choices that recognise how serious this is. There are 700 kids that have got COVID in New South Wales. There are kids that are in hospital in New South Wales that have got COVID. No children in our country are vaccinated. As a parent to every other parent, that should be motivation enough. We can't be certain what the impacts of this virus are on kids. We have got a substantial number of kids infected ourselves in this outbreak. It is spreading amongst younger people and it will continue to do that unless we all play our part. Now, I don't like having to speak to Victorians like this. I wish we were not in as serious a situation as we are. But these cases, there are too many of them and there are too many that have been out in the community for too long with infection, during their infectious period, I mean. And there are too many cases, the source of which, the chain of transmission, is not clear to us. They are genuine mysteries. And what we know for certain is that if we have another weekend where people think it's over because they want it to be over, think the rules don't apply to them, it's someone else's job to follow the rules, well then this will spread and it will fundamentally get away from us. It will fundamentally get away from all of us. And we will all pay a price for that. I know this is hard. I know everyone wants it to be over. I know that. I understand that. But it isn't. Our contact tracers are chasing harder and faster than they ever have. We have locked down faster and perhaps in some respects harder than we ever have. It's now up to every single Victorian to make the best possible choices to follow these rules so that we don't get overrun with cases, so that we aren't locked in till potentially the end of the year, and so that our nurses are not having to deal with hundreds and hundreds and hundreds of patients who need a machine to breathe. That's what we're up against here. It's Delta variant. This didn't start in Melbourne. It came from Sydney, but it must be resolved here in Melbourne. We don't get to ignore it. We don't get to pretend that because we want it to be done and dusted. It is. It frankly isn't. So, I am in better news. I am pleased to say nearly 50,000 people were tested yesterday. We got their results overnight, 48,273. We have only 15 people in hospital. That's still very challenging for them, but that number is manageable. 6 of those are in ICU and only 1 person is on a ventilator. Those numbers will not remain as low as that if this gets away from us. Beyond that, there were 28,601 vaccinations administered yesterday in our state clinics, and I thank all of those nearly 30,000 people who made an appointment, kept their appointment, turned up and got the jab. That's such an important thing for you to do, and I thank you. There are appointments open as we speak, thousands of them, thousands. If you go to the website, you can book, and you can book with confidence. The announcements made in relation to Pfizer at the end of the month, we'll have more to say about that as we get closer to the end of the month. When we know when those supplies are coming and when bookings will open. We'll announce that as soon as we possibly can. But there are vaccination appointments for both Pfizer and AstraZeneca available right now. So please go and book with confidence and then turn up for those important appointments. Beyond that, the Acting Chief Health Officer will make some announcements in relation, make some comments in relation to a breakdown of cases. But it's not just delicate, it's not a tipping point. Like, we are right on the edge of this getting away from us. And it's not because contact tracing aren't doing everything they can, they are. It's not because we didn't lock down fast enough, we did. It's this Delta variant is so wildly infectious that it will find every breach of every rule and it will potentially spread because of that. So I am imploring Melburnians and Victorians, I am asking you, in your own interests and the interests of all Victorians, we cannot have a weekend this weekend like last weekend. We must all follow these rules and find it within ourselves to push through this. I know it's incredibly difficult, but so too is having thousands of people in hospital, and that's what we are faced with. That is what we will all confront. And I again make the point, it will not just be COVID patients. Others who need urgent care will miss out because the hospitals will be full of COVID patients. So, pleasingly, we know that we can do this. We can find it within ourselves to get through this and to keep these numbers low and perhaps drive them even lower. But it won't happen by accident, and it won't happen because of things that other people do. It'll only happen if each of us play that part. And that's what this weekend and beyond has got to be about. Not waiting for somebody else to do the job for us. It's all of us playing a part in avoiding what Sydney is going through at the moment. We don't want that here. We've had it before, but not with Delta. And if we get it again, then it will mean that kids will get this. People of all ages will get this. People who are fit and healthy will finish up in hospital, and people will die. And not someone you've never heard of, and not someone who was in the twilight of their life, but people who are otherwise healthy. That's what's at stake here. If I had another choice, if there was another way, if I had a warehouse full of vaccines, I don't have any of those options. So all I can do is ask Victorians to follow these rules and not see these case numbers spiral. We're confident that if we do all play our part, we can keep this at low levels and drive it down further. But that's not even the question today. The question really is, do we spiral out of control or don't we? And that is a question that only every Victorian through the choices they make and the actions, their own actions, can answer that question. All of us must answer that question in the way we behave and the choices we make this weekend and indeed beyond.